We have to combat racial bias and discrimination at all levels of the court system. As a court system, we focused on looking at the young people who are in confinement to ensure that only children who needed to be confined were in confinement. That's a concept that we need to hold on to, and that sense of urgency that we had during the public health crisis, we need to keep in terms of our equal justice crisis that is ongoing.
It's about getting kids back in school because that's just the right thing to do, right? So our educational leaders trying to guarantee a basic needs approach. Are we providing counselors, social workers, on-site health professionals? Are schools sanitary? Are we providing food for everybody? We also know that when basic needs aren't met, this is what sets up the conditions for trauma to manifest and thrive in schools, right?
Youth need connection. They need one connected adult. They need opportunities to grow and learn and to make mistakes and to have someone care about them enough to say no and put those boundaries up. And I think that's what our system can do.
We together create the community, the culture, and our practices need to be aligned with our ethic of care and our ideals.
There's been this heightened need for a realization that we need some better data. We need more and different data, and that we don't need to think of court as the first responder for anything.
Those people who are trying to provide for your well-being are so taxed and beat down from other aspects of trying to cope with the systems that affected them. So one of the main things that our youth feel is a love scarcity, that they're not getting that what they need to make them feel like they are loved unconditionally. And so what happens is, because of it, what it does is it puts something in our community in terms of a thought system that we feel we deserve not to be loved, or we feel we deserve these things that happen to us, because a child can sometimes look out of a lens and blame themselves.
We need to get better at understanding what is causing all of this harm, what is causing all of this conflict, what is causing all of this trauma. Healing has to be proactive, right?
It really is about bringing peace to situations. When someone is trying to heal, especially from traumatic experience, whether it's an individual, even communities, it's important for us to get a certain level of respite, because you are trying to heal, but yet and still there's still more trauma that's being visited on. We have to give people an opportunity to heal. We have to facilitate the ability for folks to find those spaces to heal.
Who's at the table, and is there authentic engagement occurring? There needs to be a level of empowerment that the group of people you are looking to impact feels not just to be present, but to speak and find tangible value in their voice. There has to be this nothing for us, without us precedent set. We need to understand that we cannot effectively program, create policy or anything without the knowledge of how it will affect the people that it's targeted to.
I would love to see there be a community of practice that's developed at every institutional environment, where that community of practice is based in love, learning, and belonging. When you center love, you center humanity. And the greatest gift that teachers, staff, and administrators can offer is a place that acknowledges the humanity of our children.
A goal without a plan is just a dream. And really what we need to look at is this idea of a conversation without action is just a waste of time, right? We can talk about things until we're blue in the face, but if we're not actually doing anything about it, we've just wasted a bunch of time that we'll never be able to get back.